Most of us know exercise is one of the best things for our heart. It makes it stronger, lowers our blood pressure, and improves circulation. But here's a question people don't ask enough. Can too much exercise actually harm your heart? The short answer is yes, but it depends on how much, how often, and for how long. When you exercise regularly, say a few hours a week, your heart adapts in an amazing way. The left ventricle, that main pumping chamber, gets a little thicker and sometimes slightly bigger. That means with each beat you pump more blood. We call that an increased stroke volume. More blood per beat means your heart doesn't need to beat as often, so your resting heart rate drops. You also get more tiny blood vessels, more mitochondria in your muscle cells. Basically, your heart becomes a high-efficiency pump. But let's say you're training at very high volumes, like running or cycling hard, for hours every single day, for years. At some point, the stress starts to go beyond healthy adaptation. Your atria, those top chambers, can stretch from constantly handling a huge blood volume. Stretch them enough, and you can get tiny bits of scar tissue, called fibrosis. Scar tissue can interfere with your heart's electrical system, and that's one reason we see more atrial fibrillation and irregular heartbeat in some veteran endurance athletes. Also, when you push to your max, your blood pressure spikes. Do that often enough, and you can get microscopic damage to your heart muscle. The body repairs it, but repair tissue is not as good as the original. It's stiffer, and that's what we call myocardial fibrosis. Some research shows lifelong endurance athletes have more calcium buildup in their arteries. Now that sounds bad, but the type of plaques they get are often stable, less likely to break off, and cause a heart attack. We're still learning exactly why this happens, but repeated mechanical and oxidative stress may play a role. So here's the takeaway. Exercise is fantastic for your heart, but there's a sweet spot. Too little and your heart becomes weak. Moderate to moderately high, that's the best zone for health. Extreme, high-intensity, high-volume endurance training for many years, that's where the small risks appear.